Hello and welcome to a brand new episode of the Daily Debate. My name is Ahmed Nader and today we'll be focusing on the efforts of Egypt to be combating the coronavirus pandemic as we witnessed on Thursday the reception of Dr. Hadi, Saied, the Minister of Health, of the first batch of the coronavirus vaccine coming from China through the United Arab Emirates, or produced in China but coming from the United Arab Emirates, with the representation of China through the Chinese ambassador to Egypt at the Cairo International Airport, along with the Minister of Health. The first batch of the coronavirus vaccine produced in China, more specifically the Sinopharm company, and with the name of Sinovac. We will be having more information about the coronavirus vaccine, the instructions of President Abdel al-Sisi to be giving the vaccine to the Egyptians through the upcoming weeks and months for free, as we did see the Emirati representative at the Cairo International Airport on Thursday night saying that this is a gift. The batch of the coronavirus vaccine is a gift from the United Arab Emirates to Egypt. We'll be outlining the instructions of President Abdel al-Sisi, the efforts of the Minister of Health, Dr. Hadi, Saied, and the brotherly relations binding Egypt, China, and the United Arab Emirates through the coordination, the cooperation, and the solidarity in the fight against the coronavirus pandemic, not just in Egypt, but in Africa and in the Arab world as well, as Egypt is the first African country and the second Arab country to be receiving this coronavirus vaccine. And I'm honored to be having with me in the studio tonight Dr. Saied Abdel Hadi, the former Dean of the Faculty of Medicine at Mansoura University and the President of Horus University now. Dr. Saied, thank you very much for being with us tonight on the Daily Debate.
Thank you very much, and good night for you and for your viewers.
Thank you very much. We'll be starting with a report about the events that took place on Thursday night with the reception of Dr. Hadi, Saied, the Minister of Health, with the Chinese ambassador to Egypt at the Cairo International Airport of the first batch of the Sinovac, the coronavirus vaccine or the coronavirus pandemic vaccine produced in China and coming from the United Arab Emirates as a gift. So let's see it in a report.
Egypt has received on Thursday the first batches of the Chinese coronavirus vaccine at Cairo Airport. Minister of Health Hadi, Saied said during a press conference at Cairo Airport that the new Chinese vaccine will be available for citizens 100% free of charge as part of the directives of the political leadership. Saied added that coronavirus vaccine developed by Chinese state-owned pharmaceutical giant Sinopharm has been provided by the United Arab Emirates and has a 96% to 100% efficiency in mild and severe cases. Saied has announced earlier that the priority in distributing coronavirus vaccine would be for medical staff, people with chronic diseases, and the elderly. According to the COVID-19 Resilience Ranking Report issued by Bloomberg in November, Egypt is one of the highest-ranking countries in signing vaccine supply agreements. On Tuesday, Egypt submitted an application form to obtain COVID-19 vaccines from COVAX, a scheme led by the Gavi Alliance designed to secure rapid and fair global access to COVID-19 vaccines. The health minister stated earlier that Egypt has reserved doses of a potential coronavirus vaccine developed by U.S. pharmaceutical corporation Pfizer, which would cover up to 20% of the country's needs. Egypt has been recently witnessing rebound in coronavirus daily cases. For the first time in almost 5 months, starting 2nd of December, Egypt's daily infections have been exceeding the 400 patient mark.
We have seen the efforts of the armed forces, according to the statements made by President Abdel al-Sisi, the efforts of the armed forces and the police in combating the coronavirus pandemic in Egypt in the past few months, ever since the outbreak in Egypt in mid-February. And ever since that time, Dr. Saied Abdel, we've had several encounters on the daily debate about the coronavirus pandemic. We have received the first batch produced in China from Sinopharm, Sinovac, the vaccine named Sinovac, from the United Arab Emirates. How do you see this piece of news?
It's very good indeed. I've been waiting for that moment for the last 9 months or so. I think I've met several times throughout the course of this pandemic, from the day the WHO declared it as a pandemic on the 11th of March, coming to 9 months. This has been one of the most difficult years, not only for Egypt and the region, but also on the international level. Perhaps the Earth hasn't witnessed a pandemic of that magnitude for over 100 years. The last pandemic was 1918, immediately after World War I, and that killed around 50 millions. And after 100 years, it came back with another type of virus, also respiratory virus, but of another family. The first pandemic was an influenza virus. But that one, the SARS, as we said before, and the COVID-19 is the name of the disease. We have been waiting, not only ours, but the whole world have been waiting for that one. We have seen a lot of science mixed with politics over the last 9 months in a way that was confusing for many staff members all over the world. But at the end of the day, science has survived, and science has proved its supremacy. And despite the whole skepticism, the vaccine has come. I would say the first batch of the vaccine used in the world was in the UK on Tuesday.
Yes.
And today...
But from a different vaccine.
It is a different vaccine. I'm coming to that one. We received our first batch on Friday, which is not far, 2 days or so. By the way, America is going to start the vaccine dispatch tomorrow. So even we received
After
it.
us.
Yeah. Our vaccine is manufactured by Sinopharm, the giant Chinese company. And the good thing is China started phase 1 and 2 of the manufacturing or of the production of the vaccine, but couldn't proceed to phase 3 because China has ended markedly the number of patients of the COVID-19. So they have to move overseas.
Through this vaccine.
Through this vaccine. So phase 3 has been carried out almost always outside China. The good thing is the United Arab Emirates was the headquarters outside China, taking the rule for implementing phase 3. Not only that, but Egypt also, Jordan and Bahrain. So 4 Arab countries participated, and we can remember the Minister of Health, Saied, Dr. Saied, has herself taken the vaccine. Egypt, around 3,000 participants, but in the United Arab Emirates only, which contains 125 nationalities. So is more or less the more than 2/3 of the population of Earth, or countries of Earth, were represented in the United Arab Emirates, more than 10,000. The Prime Minister of Emirates, Sheikh Maktoum, and 2 senior ministers have had this vaccine. The vaccine is one of the oldest types of vaccine known, based on the live attenuated vaccine. Okay, but that is different from the other types of vaccine that we're going to speak about. But anyhow, that's, as we going to say, it is a turning point at the beginning of the end. We are still in the beginning, and we won't say only scientific kind of things. We are not going to throw the use of politics in Hadi, but what is available. We're going to speak about what is available, about the safety and efficacy of this vaccine compared to others, and what are the efforts done by Egypt to secure its share and protection of the public, as you said in your introduction.
Yeah, speaking of the bilateral relations or the trilateral relations in this situation, as we did see representatives of the United Arab Emirates and the Chinese ambassador to Egypt alongside the Minister of Health, Dr. Saied, in the reception of this batch of the Sinovac, or the vaccine produced in China and gifted by the United Arab Emirates. The three countries represented at the reception, and every representative spoke about the solidarity and the coordination and the cooperation between the three countries, as we did see at the beginning of the outbreak. Egypt delivering aid to China, delivering aid to the United States, to Italy, to different countries through the Minister of Health, Dr. Saied herself. How did you see the statements made by every official at that time?
I would say that's a very good political sense from Egypt. When the outbreak came in Wuhan in China back in January and February, the president ordered the Minister of Health to visit. And that visit, many people who considered, oh yeah, what's going to add to the Chinese? But that was a very good political sense. And you forecast or podcast what is going to happen. Now China is the first nation on earth to declare its victory over COVID-19. Yes, it started in China, nobody did that, but China has made very good efforts to combat it.
Yes.
And from the 10th of January, when the sequence of the virus was known, the Chinese company, there are 4 Chinese companies working on the manufacturing the vaccine. As I said, they managed to do phase 1 and 2, and they have published on the JAMA journal about that one of the best journals, an American one.
Yes.
But phase 3, the criticism of that vaccine, let's go to the science, is there is no published phase 3 yet. But the fact is that China doesn't have enough patients at that time to give a trial. So all the data came from the United Arab Emirates, and that's the second wing of this vaccine. So United Arab Emirates has done quite well to implement phase 3, so most of the results will come from the Arab world. And Egypt has participated, as I said, so Egypt, Arab Emirates and China.
In the third phase.
In the third
phase.
phase.
1, 2 and 3.
And I think the results are ready to be published. The only criticism for the Sinopharm vaccine or Sinovac right now is it is not published in a reputable journal. Comparing to the Pfizer and BioNTech, which published the work in the New England Journal of Medicine on the 10th of December, so it's a few days back, even AstraZeneca hasn't published its third phase yet. But this criticism, I'm pretty sure that the data will come forward, and the Chinese have done excellent work with the United Arab Emirates, and I'm pretty sure that this vaccine is going to work. It's difficult to judge, but we have to take the gamble.
Yes.
It's not a gamble, a political gamble. It's a gamble based on scientific evidence. The whole scientific research is a scientific gamble. I mean, we know how to manufacture vaccines since 1930. As I said, the
in
first
Egypt.
In the world,
In
not
the
in
world,
Egypt.
yes.
Perhaps France and Germany were among the first countries to develop vaccine in 1930, 10 years following the pandemic that killed 50 million. So that pandemic was 1919 and 1920. The first vaccine came in the world was in 1930, so 10 years. But in this pandemic, which evoked or erupted in China by the 31st of December 2019, in 9 months or so, we got a vaccine. So all the skepticism right now, let's go to the point that you're going to raise. All the skepticism right now is, have these studies been completed? The answer is not yet. The second skepticism or debate is, has the approval been final? The answer is not yet for all the vaccines. Now we are speaking about 6 candidate vaccines. One is now licensed in the UK and USA. That's the Pfizer BioNTech, the German-American one. The other one is the one we speak about right now here in our area from China. There is a third one, in the Russian one from Sputnik, and it is a different modification based on a vector. AstraZeneca hasn't started yet, but another. We're going to speak perhaps on a little bit about the scientific background
and the differences
of this
between every one of them.
Yeah.
But speaking of the results of the vaccine that we have got produced from Sinopharm and called Sinovac, it has, as Dr. Saied said, the Minister of Health, an 86% efficiency. Is this a good percentage or not?
Fine. We have to compare with the current status and compare with other candidate vaccines.
Yes.
The declared result so far, although it is not published yet in the scientific journal, we rely on the scientific community as a scientist. We hope that to see the results. But I believe and I trust the data that 86% efficacy is quite good. Anything above 80% is very good. So this is 86%. Compared with the Moderna and the Moderna one, their RNA, and the Pfizer one, BioNTech, is around 95%. But that's not the whole story. When you put things, you put its context, what we call it the cost-effective analysis and the availability and the efficacy are all a lot of words that need explanation for the scientific community. This vaccine is quite a cheap one and suitable for our circumstances because it can work in a temperature of 4 degrees centigrade, the ordinary fridge. The Moderna vaccine is 10 times more expensive because it is based in advanced technology of a messenger RNA and on nanoparticle as I feel. So the cost is tenfold for the American one. Number 2.
But does it have higher efficiency?
Yes, it has 10% higher efficiency. The most difficult for our region is that it needs a minus 70 to minus 80 during distribution, and if it for a very short time, it can destroy the vaccine. So in our circumstances, let's speak the facts on the ground. Even the Moderna one means minus 20. We don't have that one. One of the reasons why vaccines failed in the past in this area is what's called the cold chain events. You need to transfer the vaccine in a cold environment. As I said, in our circumstances, this vaccine, the Sinovac one or the Sinopharm vaccine, is effective and efficient at a temperature of 4 degrees at the ordinary fridge. So you can transfer your vaccines. So the cost is suitable. Number 2, the atmosphere and the transport is more suitable for our locality. So the comparison is not only in the effectiveness, but regarding in the vaccine, we speak about safety and efficacy. Safety is proved fine. I mean, there is no life-threatening complications of the vaccine. By the way, China has another candidate vaccine, and one patient died in Brazil. And they stopped the attack, but on investigation, this guy died from an overdose of medication. So it was not the vaccine they caused.
Yes.
They said even for the other vaccine, which is used in the United Kingdom, they say it caused hypersensitivity reaction. Hypersensitivity is unique. It can happen for any vaccine, for any drug. So it is safe. Yeah. So the only documented side effects for the vaccine is locally it causes pain and tenderness, erythema, and swelling. And systemically it causes mild pyrexia, myalgia, muscle aches, and headache. These are very reasonable and could occur with any medication. So regarding safety, it is safe, and regarding efficacy, it is acceptable.
How do you see the results of the clinical trials in general for this vaccine, as we do know now that Egypt has been part of the clinical trials for the past few months, not just phase 1, but phase 1, 2, and 3?
Absolutely, yeah. Phase 1, to make it simple for the ordinary citizen, I would say phase 1 is when you aim to test the safety of this medication, and usually for volunteers of hundreds or less than 100, so say 20, 25, 2 digits I mean, less than 100. In phase 2, you think that you know it is safe, but you want to explore it for a larger number. So we speak about hundreds, 200, 300, up to 1,000. And you also determine, in addition to the safety, the dosage. I'm going to give 2 doses or 3 doses. I'm going to give it every 3 weeks or every 3 months. These are questions, and the clinical trials are in phase 1 and 2. In phase 3, you add larger numbers in thousands. You go to 10,000, 200,000, quarter of a million, a million. The Chinese have tested it over 1 million personnel, which is very good. And in phase 3, we call it efficacy. We rely on the efficacy, on the effectiveness of the vaccine to prevent the vulnerable to develop the disease if they are exposed. And that was proved effective as well. So the vaccine from safety is okay. From efficacy, I would say, till the current moment. And in our circumstances, when we speak about 2 months from the only follow-up for phase 3, in ordinary, we should test for 6 months, so we cut it short. Another shortcut for the vaccine is we have run parallel phases. So I've done phase 1 and 2 together, and phase 2 and 3 together. This doesn't, So
to be saving time?
To saving time. In an ordinary vaccine development, it takes 6 years. And this vaccine, it took just 9 months. It is an emergency situation. And again, all the certificate that is giving, or the license that is giving, is called for the emergency use. It's given permission to be used as an emergency situation. We don't have better alternatives. We are in a, as we call, in a time of war, don't use the situation or the law of the peace. Peaceful situations needs peaceful law, but we are in the battle, and that is the best available. If anyone in the world has better alternative, please come forward. That is the best, and that is the success for the scientific community. Anyone who can do better, please go.
Of course. Speaking of the other statistics of the vaccine from China, the Sinovac, the health ministry said that the Chinese vaccine has a 99% efficiency in producing the antibodies. So what is the difference between the efficiency of the 86% and the 99%? And there's another statistic, a 100% efficiency in preventing the cases from showing moderate or severe symptoms. So there are 3 statistics regarding the same vaccine. What is the difference between them?
That's very good scientific point. Again, in a very simplified form for the ordinary person to understand.
Yes.
We knew that that is caused by a virus. Okay, we isolated this virus and sequenced, so we know its map. Third point is we got this virus or part of it isolated and then grown in a larger number and give it to in a form that can stimulate the immune response. We have tested that on the experiments on animals, and we found that it is stimulating the immune system. So this virus, in particular the spikes or the crown of the virus, is called the S. S stands for the surface protein. That the spikes or the crown on the surface, that's the most interesting part of the virus. This can be identified by our immune system in animals and in human beings. And it produces neutralizing antibodies. So the body, in its response to that, stimulates 2 types of the immune system, our body, B cells and T cells. These will produce antibodies. That's what we call the neutralizing antibodies or the antibody production as a result of the exposure of this virus to the immune system.
Yes.
If a virus doesn't stimulate the immune system, it is failure. So all the vaccines we speak about have managed to stimulate the immune system. That's what we call it. It stimulates, it forms neutralizing antibodies or produced antibodies. So it stimulates the immune system in 100%. That's good. So yes, we got the, that point is covered. But getting a neutralizing antibody doesn't mean that you are protecting 100% of the population exposed to the virus. It varies because human beings differ in their immune status. Human beings differ in their response to infection, and human beings have different disease profile. So your status is different from mine, your age is different, you don't have a systemic disease. So all in all, we take a large number of the population and see and compare how many of those exposed to the vaccine are going to develop the disease. Compared with the placebo, phase 3 usually give placebo people who are given no drug at all. Okay, in the form very similar shape, you cannot differentiate, but we know that that one is given the virus in an attenuated or part of it, and that one doesn't, is given a placebo. Then we compare the two. If the 100 of that pool has 80% developed disease, but 100 of that one, none or very few, then it is successful. So prevention of the disease is some other indicator which we call it 86% preventive role or 95% preventive role. So that's our two measures. And again, the magnitude of the disease that develops in the vaccinated stuff is another variable. So we can, it prevents the development of severe disease. So you got these three indicators, as you pointed out, to the neutralizing antibodies that's 100%, 99, the efficacy that in preventing disease 86%, and much more in preventing severe disease.
Speaking of the side effects, as we have seen in the past few days, that a number of people and patients have died in Britain, for example, 6 or 8 through the Pfizer vaccine. Should we be afraid of any side effect of the vaccine that we have from China? Or, as you said, doctor, that the side effects of the Pfizer or BioNTech vaccine had nothing to do with the deaths of those patients?
To be honest, and to the best of my knowledge, there is no reported death from the vaccine. The vaccine, either through phase 3 or 2-3 days of usage of license in the UK, I'm not aware. I'm aware of the guy who died in Brazil, and that was proved to be caused by overdose of
not related to the vaccine.
Not related to the vaccine. If 6 have died of the vaccine, I expect that these are going to kill the vaccine before it starts. So I strongly doubt that. In Europe, there is a huge skepticism and debate about the use of vaccines in general. The good thing about our locality is that we are very committed to the vaccination. And that is one of the main reasons why the percentage of infection in Egypt is kept low, because we have had very good vaccination during childhood. We have had the BCG vaccine for tuberculosis and the measles, mumps, and rubella.
They don't have the same system in Europe, for example.
They dropped it in most localities and most developed nations, especially in the UK. I used to live in the UK for some time, and they were not quite happy with the vaccine. I don't know why. They said it causes inflammatory bowel disease, and our community is clean. But now, after that pandemic, we knew that getting a vaccine is much better than not getting the vaccine.
And the UK in specific has a very high rate of deaths and infections of the coronavirus.
Yes. Of course, number one in the world is the United States, but UK is badly hit. Italy again, Brazil, and India.
Of course.
That's right.
Speaking of the candidates or who will be taking the Chinese vaccine here in Egypt, first, as we did see Dr. Saied speaking about, it will be for free, fully, as President Abdel Fattah al-Sisi had instructed. But who will take it first? Because she said the elderly, the medical crews.
Yeah.
Who do you think will be taking it first?
We have to make priorities, you know. We got 50,000 doses. This sufficient for 25 because every person is going to get 2 doses, one at 0.0 on the first day and the second dose after 3 weeks. So all what we speak about is 25,000. So we have to make priorities. Who should be getting the vaccine? Number one is the front line of combating the coronavirus are the medical staff. Those especially in working in isolation centers, those in the intensive care, those looking after badly affected patients in the intensive care or the high dependence units in the hospitals. We already have the chest hospital, the fever hospital, the centers isolation, as I said, nurses, medical staff, and workers in that center. That's number one. And then comes the, I think the number is of this category exceeds, if you put the working in these facilities, they exceed the 25,000 that already have. But next to them will come the patients who are at high risk, especially those who are taking immunosuppression for cancer, and those on dialysis and those on immunosuppression. This come number two. And as the number of the vaccine, the doses of the vaccine more available, then everybody can get it. But we have to put priorities. I would say here, you remember we have discussed the Gavi, the Global Vaccine Initiative or Alliance that we spoke about, and Egypt is a member. You remember when the Prime Minister in the UK have opened that. There was $2 billion donations and $1 billion from Bill Gates, even before we know that the vaccine is coming. So Egypt has a promise to get 20% of the population covered from the Gavi, or the Global Vaccine Initiative, for free, of course, because we are member of that international alliance. So we guaranteed from the Pfizer category, the mRNA vaccine, which is the most expensive one, that we're going to get around 20 million. Maybe over the next few years, yes. But
so we could be getting different vaccines here in Egypt?
Yeah, absolutely. Yeah, definitely. Egypt has a promise to get 20% of its need from the Gavi, or from the Global Vaccine Alliance, and we have now the deal with the Chinese to get more. But we are 100 million.
Yes.
And I would say the vaccine right now is not tested for the pregnant, lactating, and children. So we are not speaking about this category. The studies are still not. So if a pregnant lady said, oh, should I get the vaccine? I said no. If a lactating lady says, asked about that, we say no. So the pregnant, lactating, and children, they are not tested. We don't know. We don't know. Healthy adults, all the studies are done between 18 or 19 and 59. This is the tested group. AstraZeneca has tested in the elderly as well. But the remaining, we don't know. So we only know the tip of the iceberg, but a lot of studies are coming to come. As I said, we used to assess 6 months after launching the vaccine. Now we started after 2 months because of the emergency situation.
Yes.
But with time, all these companies, by the way, there are 6 candidate vaccines in use now, but there are over 280 vaccines in different phases, including 4 from Egypt. And the Minister of Higher Education has pointed out that Egypt will have its own vaccine, very similar in technology to the Chinese one, but probably later this next year.
Yes, and this brings us to the point of producing the vaccine, as we will be seeing in the upcoming report, the statements made by the Minister of Health, Dr. Saied, not just about receiving the first batch produced from China and through the United Arab Emirates, but producing the vaccine to be defeating the coronavirus pandemic in Egypt, more specifically in Vaxera. So let's see it in the upcoming report, the details.
Egypt has begun talks with the Sinovac Biotech to manufacture the Chinese company's coronavirus vaccine. Health Minister Saied said on Friday that Egypt wants to meet the demand of Egyptians and other African nations. She added that after Sinova's auditing, financial negotiations are underway over the expenses of obtaining the production license. The minister noted that a production line was established in the headquarters of the Egyptian holding company for biological products and vaccines, adding that the World Health Organization has presented some recommendations for Egypt to meet. She affirmed that the production line is now ready, the staff are trained, and legal permissions have been issued. This comes a day after Egypt had received the first batch of coronavirus vaccine developed by Chinese state-owned pharmaceutical giant Sinopharm at Cairo airport, which was flown from the United Arab Emirates. On Friday, Saied said that Sinopharm vaccine will be optional and free of charge for all Egyptians, as it is the state's responsibility to provide the vaccine and protect society. She went on to say that Egyptians willing to take the vaccine can register through an official website the ministry will launch next week. Egypt has been carrying out Phase 3 of the clinical trials of the Sinopharm vaccine. Saied said that the vaccine's safety and efficiency were tested on the short term, adding that she does not expect the vaccine to have a long-term effect. Saied said Egypt has secured cold storage units that can accommodate up to 110 million doses of the vaccine. She reiterated that priority will be given to medical staff working in isolation hospitals as well as fever and chest hospitals. Around 60,000 patients suffering from kidney failure and cancer will be prioritized, in addition to people suffering from chronic diseases and people above 60 years of age. The health ministry has earlier explained that Sinopharm vaccine has proven 86% effective against coronavirus, 99% effective in producing antibodies, and 100% effective in preventing cases suffering from moderate or severe symptoms.
Welcome back. You're still watching the daily debate. As we did see in the past report, the efforts of Egypt to be not just combating the coronavirus pandemic, but producing as well in Egypt a vaccine against the coronavirus pandemic. Dr. Saied Abdel Hadi, for how long do you think this vaccine will be lasting and it will be protecting us from the coronavirus pandemic? Do we need to take it more than once during the same lifetime?
Okay, coming to the gray area, the short answer is we don't know. Nobody knows. We just started. Hopefully it's going to work. Hopefully it's going to give long-lasting immune response. But let's go back for the report.
Yes.
To say that there are two different issues here. The vaccine that the Minister of Health is speaking about is the Chinese vaccine that's patented in China, and we are going to get licensed to produce it in Egypt. And I'm going to speak about another point, that Egypt has patented a vaccine in the pipeline. We have done all the preclinical studies and we already are, perhaps we have started the clinical trials. So we'll have an Egyptian vaccine. And that hopefully by the late next year. So Egypt will have its own version of the corona vaccine as well.
Yes.
And I would say it is based on the same scientific principle of the live attenuated vaccine that like the Sinopharm or the Chinese one.
Yes.
But we will have ours. But the efficacy, the long-term effect, the lasting effect for that vaccine, all of them, we don't know. And anybody would say, let's wait and see. This is the proper answer.
Speaking of the vaccine itself,
Yeah.
how would you explain to us the process of taking the shot? What happens next?
Excellent. Yeah, there is a very long journey to get the shot,
Yes.
as we have been speaking about that one. And after we get the shot, there is another journey. So first, before you get the jet, the injection, let's start, or the dose, or you get the vaccine, is given in the deltoid.
Yes.
This is the safest and most prescribed area, but in the thigh for some person who cannot accommodate that one. Okay. There have been 9 months, and on average, it could have been 6 years to develop that vaccine.
Yes.
The first trial of the vaccine dating back to the 1930s, as we said, and that was isolating the vaccine, attenuating it, or making it weak or killed, and then give it to the human beings. Okay? That was the influenza vaccine. Then we tried to study more on the virology, and we knew that it's not the whole virus that's working, but part of it. So we start isolating the part of the virus specific to stimulate the immune response, put it in a vector. It's called the adenovirus. Another virus, benign, doesn't cause disease. So we carry it on that part of the virus, and that's in the world for another 40 years. That's the AstraZeneca one and the Russian one.
Yes.
Working on that one. And now we have managed by two physicians, Turkish-born German scientists. They are actually physicians, doctors, I mean, who have managed to upgrade the not part of the not the protein, but rather the messenger RNA that is going to code or manufacture the surface antigen or the spikes of the virus. That's a very advanced technology, and to carry it not on a vector but on a very small particles called the nanoparticles. So that is the expense of the Moderna and the expense of it. Make it expensive because the RNA technology is difficult and needs very, very sophisticated technology, and also the carrier, the nanotechnology and the nanoparticles are expensive. And this very narrow will carry the viral particle or the RNA, the messenger RNA, that's going to transfer to the cell, and inside the cell this will be taken by the cytoplasm and produce a protein that's called the surface protein that makes the virus. That's the journey till we're speaking about right now, and the sequence of events from the virological point of view. Now, yeah, few people have got the vaccine in the world,
Yes.
in addition to the clinical trials, of course, third phase. That's day 0, okay? We expect you to get local and systemic symptoms, as we said before, local tenderness, local pain, swelling, that are all tolerable. It's not severe. Then we expect you to develop mild pyrexia. Even the Minister of Health has suffered that during the phase 3. Myalgia or muscle aches, feeling weak, as we call it, you know, and mild headache. These are all tolerable symptoms.
Yes.
If you get much more than these, please report that to your doctor and you will get help. After 3 weeks from today, you will get the second jab or the second injection or the second dose. And we're going to follow up. You should be followed up for another 4 months to know if there is any side effect of that one. The efficacy will be tested by how many of the vaccinated people will get the disease. But the safety is how many of those vaccinated will get side effects.
And do you need to be 18 or older to be having this vaccine? Does this mean that children wouldn't be having it?
Absolutely. The vaccine in phase 3 is tested all over the world on the adults between 18 and 59.
Yes.
AstraZeneca has tested in a group of elderly, and it's proved safe and effective as well. So we say children are not tested and shouldn't get it. By virtue, children have the lowest rate of getting coronavirus. Thanks God for that. Pregnant ladies are not tested, and we do not advise it, especially for this vaccine because it is a live attenuated vaccine. Okay. Lactating ladies are not tested, and we do not recommend it. If you have any other morbidity, or I mean disease, you need to discuss with your physician or your doctor. It is voluntary, but the priority is for the health staff, people on the front line of confronting coronavirus patients.
Yes. We have spoken about different vaccines from different countries, produced from partnerships, different partnerships throughout the world, in the United Kingdom, in the United States, in Egypt, in China. What is the major difference between each one of them?
Very good. There are differences in the technology and how to get the vaccine working. There are differences in the costs, and there are differences in the prerequisites for use. So let's speak now about the 6 candidate vaccine that's known in the world. The Chinese one are the cheapest, and they rely on whole attenuated virus. The whole virus taken from a diseased persons is paused or inactivated by chemicals, forget about the name. In the early trials, many years back, we used to culture these virus till it gets weakened. Now we put a chemical in it.
Yes.
Okay. So instead of causing a disease, we prevent the virus from causing the disease, but still can stimulate the immune response. This is the low-tech, cheaper vaccines that works, or that does work. The vector vaccine, in which they don't use the whole virus, but rather use particles of the virus, the DNA or the protein, they call the surface protein, and put it in another virus called the adenovirus, that's a benign virus, so the other virus will infect the cells. It's also cheaper one, because the adenovirus is available, we know about it for more than 40 years, it's used all over the world, it is a benign virus, it's just a vector carrying on. Its efficacy is more comparable to the Chinese one or the Sinopharm one. The whole virus and the viral particles.
Yes.
But the most advanced and the most sophisticated and the most expensive is the Moderna and the BioNTech Pfizer. In that one, they have used the messenger RNA. RNA, the virus is either a DNA or double strand or a single strand called RNA. But this strand will go inside the nucleus, duplicate itself to become double strand, and the process of multiplication.
Yes.
To form proteins, because all the material, genetic material is present in the nucleus of the cell, but it sends a message to the cytoplasm through a messenger RNA. They sequence it, and they know it is a very tiny part of the material, so it's very delicate, and so could produce on massive. So you can produce millions in a short time. So you can make many, many doses, but it's expensive, and to carry it inside the body, they put in a nanoparticles. So the technology is difficult, the nanoparticles are expensive, but you can produce huge amounts of it, and the most significant, it needs this part of the messenger RNA is very sensitive to heat. A temperature of -70 or -20 at least is needed. So there are differences, and the available in the world, we are speaking about the Chinese one in Egypt,
Yes.
in Arab Emirates, in most of the Arab countries, in most of Africa, and that's what China is hoping for. Again, in the States, in the UK has its own vaccine, AstraZeneca, but they didn't license it yet.
Yes.
But they licensed it, the BioNTech. It seems to be the Moderna and the BioNTech will be serving the Western countries, and China will be serving our region.
Yes, and finally, in a minute, do you encourage the people here in Egypt more specifically to be taking the coronavirus vaccine?
Yes, I do. Personally, I'm keen to have the vaccine because I'm one of the physicians who are meeting patients every day, and I see patients with corona. So I am one of those who are candidate, and I am willing to take this vaccine.
Yes.
I just recommend for my fellow Egyptians, don't listen to the propaganda. Don't be naive to think that the government of China, Arab Emirates, and Egypt are playing politics with you. They are very sincere.
Yes.
They have done a lot for the last year to protect the community and the Egyptians from that sinister or sinister virus. This is the only hope, is to get vaccine, to dispatch or get 60% of the population, try to cut the chain of transmission. So yes, I do.
Yes.
We are in the early phases to be cautious. We will know more as we go. But for the time being, on safe backgrounds based on scientific evidence, this is the best we can have.
Yes, Dr. Saied Abdel, the former Dean of the Faculty of Medicine at Mansoura University and the President of Horus University. Thank you very much for your valuable information here today on the Daily Debate.
Thank you so much.
Anytime.
Wishing all the best for our community.
Thank you.
Thank you.
And this brings us to the end of the Daily Debate for tonight. Thank you for watching, and goodbye.
Good.